Now, we're going to go into Citizens Memorial Hospital. As healthcare grows more and more complex each day, technology is becoming more and more a part of the diagnosis and treatment of health issues. You may not care for blood like me, but you may be tech savvy. And tech savvy people have a place in healthcare. There are some great occupations and opportunities. Let's go look in the world of imaging, diagnostics, and radiology.
Initially, I wanted to be a nurse. I decided that healthcare was where I wanted to be because I wanted to help people. And then got a little more into my major and realized radiology was more where I aligned with. So I chose radiology as my major in college and started radiology school and realized that the imaging aspect of it is really interesting. We see new stuff every day. It changes every day. My name's Jessica. I've worked with CMH since 2011. I've been a registered radiologic technologist since 2011 and registered as a computed tomography technologist since 2014.
In radiology, there's quite a few options for different modalities. I started in radiology as an X-ray tech, which is generally how people get into the field. Once you become an X-ray tech, you have some options to branch into other modalities, to either cross-train or go to specialty schools. My name's Christy. I'm a registered diagnostic medical sonographer. I'm registered in abdomen, OB, and GYN, and also registered vascular tech. I'm also a registered X-ray tech. I started in radiology in 2007, worked for about 4 years as an X-ray tech, and then the last 12 I've been an ultrasound tech.
Honestly, I chose X-ray because every day is kind of like a puzzle. So you'll get patients that, let's say one comes in through the ER with a broken arm. You have to get the best views possible with what the patient can do. So you have to think outside the box, what's going to help the patient and the doc help them get better. My name is Ben French. I am a radiology tech at CMH. I've been doing X-ray since 2019.
MRI uses your body and radio waves and a big magnet to take pictures. We can image any part of the body. They average about 20 minutes. And they're very detailed pictures and can help the doctor diagnose the problems. My name is Amber and I am an MRI technologist at CMH. I've been registered in radiology and MRI since 2000.
My typical day is going to change depending on the day. So I could have a day where I'm just doing a bunch of portables. I could have a day where I have fluoro cases, where I have surgery cases. Honestly, it just depends, because I mean, even with portables or inpatients, I go all over the hospital.
So a typical day for a sonographer, we're going to review patients' history, look at any prior imaging they have before we get them for their appointment, any pertinent information in their medical record that we need to check into, and then we scan the patient, take images. When we're done with that, we also write a report for the radiologist that just gives our impression of what we saw during our scan. We know any major abnormalities or anything that we want the radiologist to pay special attention to.
I work at the hospital and the outpatient imaging center. We do several MRIs a day, taking either inpatient or ER and outpatient. We just take pictures and diagnose with our images, and we're very busy. We have several patients a day, and we have scanners at both facilities, here at the Douglas building and the hospital.
Most days I'm doing a full schedule of CTs, which involves 25 to 30 a day, depending on how busy we are. We do a lot of contrast studies, so we start IVs, do contrast injections, and then do the CT scans. And then we'll discharge the patient, take the IVs out, and send them on their way to get the results of their doctor. I like that it changes every day. I see something new every day. You know, the human body is different for everybody, so the anatomy can even be different, and it's just really interesting to see the insides, to see what's happening in there and get patients' diagnosis.
I like radiology. I like to help people. I think imaging is very important. I know that people, when they come in, they're hurting and they have problems, and it's hard for them to do, but I like to help them find the problem. Even I don't want people to have a problem, but we can help find the problem, help it get a resolution with their symptoms.
So I choose to stay in this field because of the people. I've had other jobs to where, even in, let's say in retail, where it's supposed to be people oriented, this one is more satisfying to help people out.
So one of the things I love about radiology at CMH is my coworkers. My coworkers are my family. We're very close. Radiology is typically a pretty small department. Even in bigger hospitals, it's a fairly small department. So you get to know your coworkers very well. So we are kind of just a family here, and it's very close-knit here. I also really like the fact that I'm always learning. Even after 12 years of doing ultrasound, I still see new things. I still see things I don't recognize, and I can go talk with my radiologist on it. So I'm learning every day.
Fantastic. I've always been intrigued by the world of imaging radiology, and live with us for CMH is Gayla Hankins, Director of Radiology, and Robert. Robert, welcome, and Gayla, welcome.
Good morning, good afternoon.
Well, if you kind of just go a little bit more in depth on imaging and what you like about your job, and then we'll open it up for some Q&A. We got questions coming in from around the state and around the country.
I'm going to hand it off to Ms. Galick as Director of Radiology. I work in human resources, and we're glad to field any questions about that.
Thank you. Like I said, my name is Gayla Hankins. I am the Director of Radiology. I got my first job in radiology in 1988, so I've been doing imaging for a really long time. Most of my career, I was on the education side of it, and then in 2011, I made the move to CMH and became the Director of Radiology here. As you can see on the video, imaging covers a lot of different areas. You've got your X-ray, CT, MRI, mammography, and nuclear medicine. We didn't really get into in the video, but those are also parts of imaging, and as well as ultrasound, which you saw. Most people start out in X-ray. They go through the training to become a registered X-ray technologist, and then they move on to additional training for CT, MRI, ultrasound, whatever they choose to go into next. Some areas like ultrasound and nuclear medicine, you can do a direct path and not go through the radiology tech program first. So it kind of just depends on how sure people are what they want to do. In radiology, we do everything: emergency room patients, outpatients. Here we do a lot of work with cancer patients. So there's just a wide variety of patients and different things that we see in a day, no matter which modality you're involved in.
Fantastic. Gayla, we have a couple students that want to go live with your question. Emily from Independence, Missouri. Emily, if you are live, go ahead and unmute your video and your microphone. Take just a second for Emily to pull in. Emily, are you pulling up now? I guess it's a sign we need more broadband in the state of Missouri. Okay, we're going to go ahead and, if Emily is not there, we'll go ahead to go to Autumn. Is Autumn there? We can go ahead and pull up Autumn to ask her question. Oh, hello.
Hi. What is imaging and how does imaging work?
That is a broad question. Imaging, specifically, people usually think of X-ray to start out with, and that actually is radiation that is utilized to form an image. But imaging also includes MRI, which uses magnetic waves to working with the patient's body to create imaging. We have nuclear medicine. Nuclear medicine actually uses isotopes that are radioactive that we inject into the patient's body and use that to see function in organs. Ultrasound uses sound waves, and they use the sound waves to make images. When people hear ultrasound, they always think, newborn or babies, OB type stuff. But that's usually just a real small part of what a sonographer does. Ultrasound, we can see vessels, cardiac, as well as, women's health issues and things like that.
Live. It looks like Emily's having some problems with hers, but her question is this: what are some jobs that need to study radiology or diagnostic imaging?
Could you say it again?
Yeah, I guess, so what are some of the jobs that need to study radiology or diagnostic imaging? I kind of think that's what do you need to study in order to go into radiology and diagnostics?
So the training for jobs for diagnostic imaging, you can get jobs in outpatient areas, in the hospital, emergency rooms. The actual training generally starts with at least 1 year of general prerequisites at a college before going on to a radiology program. The radiology program is generally 2 years, with a large clinical component in that. And after 2 years of X-ray school, there's a large national registry exam that you take, and then you're considered a registered radiologic technologist. And then at that point, you could move on to CAT scan or MRI and get additional training and additional certifications.
Gayla, if I'm correct, once you get that initial certification, then you can learn on the job some of those skills and then test through the accreditation.
Yes. And different places have different requirements for that, but some places will train as part of the job. We do that here in some areas, and there's also programs that might go ahead and finish with a bachelor's degree and a certification in MRI or CAT scan or something like that.
Great answers. Camdenton Middle School has a question. I have the same question because I get a little confused myself. What is the difference between an MRI and a CT?
Great question.
They both use what we call cross-sectional imaging. So I always tell people to think of that like if you sliced a person up like a loaf of bread and you pull out one slice and just look at that little image, you can see a lot more anatomy there. So they both use that type of imaging and segmented imaging. But CAT scan uses X-ray, so it's radiation, and MRI uses magnetic imaging. So it's a giant magnet. It's one of those you have to be real careful when you go in the room. We have to screen patients really well, because if you go in with metal in your pocket or something, the magnet, it could actually get just stuck to the magnet. So it's an interesting area to work in, and it's a big safety area because you have to really be careful of the patients before they go in and make sure they're properly screened. The images are going to look similar, but MRI is really good for like joints and some certain soft tissue anatomy, and CT is good for chest studies and different things. So it kind of depends on what the doctor's looking for, which one he'll order.
So if I'm an athlete, most of the time, if I do something to my ACL or my elbow or something along those lines, MRI is going to be the first that you order up for me.
MRI is going to be what they want. That'll show a lot of detail of the joint and if there's a tear in there, which X-ray does not show.
So we just saw the Chiefs won the Super Bowl. So I got to think, when Patrick Mahomes sprained his ankle, they put him in an MRI machine to see what was going on.
I would say they did, yes.
Hey, we have some great questions coming in now from Sherwood High School. What intrigued you to pursue your career in radiology, Gayla?
Honestly, I always wanted healthcare. That was when I was a teenager. My grandma took me to be a candy striper at the nursing home. And I just always wanted to go into healthcare. And I started with my 1 year of prerequisites, and I just looked at different studies or different fields. And then I took a tour of the imaging department at a local hospital. And yeah, you start looking at what they're doing, and you can see inside the people and what's going on in there. And it's just, it really did intrigue me. And the technology just advances so quickly. There's been so many changes in the field just in the past few years.
I would imagine new equipment all the time.
All the time, yes.
So that leads us to our next question. Fulton High School asks, what type of certifications need to operate an MRI machine?
You need to be a registered MRI technologist. And so it's the ART, the American Registry of Radiologic Technologists, have different levels of certifications. And generally, the initial certification would be for X-ray, and then they would move on to MRI. They are coming out with some programs now that go directly to the MRI registry without going through the X-ray first. So if somebody's absolutely positive MRI is what they want, then there are options for that. You just have to research that.
Excellent. And then what are the salaries? Follow-up question is, what is the average salary for a radiologist?
It varies based on the certification. So your entry level X-ray tech just out of school and it's going to vary across the state as well. But I mean, I think in Southwest Missouri, a tech would start 18-ish dollars an hour. It could go to 20. And then as you add certifications, that typically sees an increase in the base rate that an individual makes.
Excellent. Good question. Good question. Another question. Hancock Place High School. I think that's located in St. Louis. How do you prevent negative effects from imaging? Great question, Hancock.
So I know from the people side of it, we screen our employees. They all wear, you can kind of see on Gala's badge, all of the radiology staff have radioactive monitors that they have to turn in, and those get logged to see how much exposure they've had over time frames, and those are reported so we can monitor. And then if there's ever any type of leak or anything like that, those get reported as well and monitored on each staff member.
Wow. It sounds like you take safety, job one there at CMH.
Very much.
We do, yes.
We kind of hit this one. What are the risks of nuclear imaging? And one of the questions that came from Cross Key Middle School, just to follow up, can it make you sick? Good question.
Not at this point. The imaging would not. It's really, the doses over the years have come down so much, and we try to watch that. We have, it's ALERA, as low as reasonably achievable. And so we watch closely that, patients get the exam they need when they come in and do it right, so they don't have to have an additional image. And there's different alerts with patients that show if they've had multiple studies. But I don't want to say it cannot, but with all of the measures that we have in place, I've never seen it.
That's good to know. So, Gala, parting shot, what would you suggest to students around the state and really around the country to go into imaging?
If you want to go into imaging and you can, I would suggest shadowing at a local hospital because it's just really hard to encompass everything that you're going to come in contact with. And some people think ultrasound is their dream job, and then they get in the room and it's kind of dark and quiet, and they're studying the image and they find out that that's just not for them. Fortunately, with imaging, if you get started, there's a lot of different directions you can go. You don't just have to stay with your whatever you started out with, but I would say really get to know what you're looking into and make sure you have a good idea of what the job would entail.
Fantastic. And Jeremy, any final words of wisdom for the students out there?
No, we really appreciate the opportunity, and if anybody ever has a question, they can reach out to us.
Excellent. And we did have some students who wanted to do some internships. So I would say direct them to your webpage at CMH.
Yep, that'd be a great spot.
Fantastic. Well, thank you so much for what you do day in and day out to kind of diagnose us and keep us healthy.
Thank you.